行了，现在我斌哥，你去看看斌哥就行。行了，好了，朱杰别冰，谢谢。哎，斌哥，斌哥的那台，斌哥那台是给你了吗？中文点啊，斌哥那台是给你了。那就行。10号之后还开吗？10号之后。现在不让啊，再开就得回我们这线出去，是吗？这边说就跟那个两会了嘛，就不能用。对对，一看办两个大事儿。说实话，我对你们太热了，都穿不住了这衣服。直接衬衫。直接衬衫好。这是有点热。他今天拿话筒那个穿的对呀，拿话筒啊，就得穿这个。这是口罩可以摘吗？可以摘的吗？啊？我没看说呢吧？看完了。是吗？人说你这回你这回那家伙。说实话，是那个多汗。就这家伙应该是。这都有，不知道我有，你这嫂子都有，咱们都有这么人。成名人了。是，现在邻居都差不多都这样。你们这怎么呢？你们这镜头给的更大。我也不看电视，不知道。看戏。也是，对，就今天第一次过来，就那个这两个女孩都是我们这儿的。爽。哎，我胖麻烦了，干不了，我现在还能凑合干。他没取好那景。没，马上。
各位媒体朋友，大家下午好。
Dear friends from media, good afternoon. Welcome to this joint press conference by the State Council Epidemic Prevention System. Today we have with us Mr. Wu Jinglei, Director of Shanghai Health Commission, and also we have with us Mr. Shen Xiaodong, Deputy Director of Shanghai CDC, and we have with us Mr. Zhang Wenhong, Shanghai Huashan Hospital Department of Infectious Disease Director and leader of Medical Expert Group of Shanghai. And also we have with us Mr. Chen Zhen from Shanghai Beijing Hospital and the 3rd medical team to Hubei from Shanghai. And we also have with us Madam Liu Hui, the Big Bridge Community Health Service Center Director of Yangpu District, Shanghai City. Now I want to brief you about the cases information by the end of 29th April. 31 provinces, autonomous region, direct municipalities, and the Xinjiang Production Corp confirmed the new cases. All of them are imported cases. 2 cases in Shanghai, 1 in Inner Mongolia, 1 in Jilin. There is no new deaths, and new suspected cases increased by 3 cases. All of them are imported cases from Shanghai. And newly cured discharged cases 32 in 29th, and also close contacts who is discharged from medical observation was 708 cases, and severe cases reduced by 9 cases. For imported cases, at present we have confirmed cases of 525 cases, among these severe cases 13, and the current suspected cases 7. Accumulated confirmed cases was 1,664 cases. Accumulated discharged cases 1,139 cases. No death case. By the end of 29th April, according to different provinces and the Xinjiang Production Corp, the current confirmed cases was 619 cases. Among the severe cases was 41. And accumulated discharged cases, 77,610 cases. The accumulated deaths was 4,633 cases. Accumulated reported confirmed cases, 82,862 cases. The current suspected cases 10. Accumulated close contact was 732,369 persons, and the close contact under medical observation was 8,032. In 29th, there is no confirmed case and no suspected case in Hubei, and the accumulated discharged cases were 33,616 total. For Wuhan, it was 46,464. The accumulated deaths was 4,512 in Hubei. Among this, 3,869 cases in Wuhan. Accumulated confirmed case, 68,128 cases. Wuhan, 50,333 cases. Different provinces and Xinjiang Production Corp reported they increased symptomatic cases 33. Among these imported cases was 2. At present, there was no conversion to confirmed case, and 28 cases was discharged from medical observation. Among these, 6 cases was from overseas. Asymptomatic cases and medical examination was 998 cases. Imported case was 129 cases. We accumulated receive Hong Kong, Macau, Taiwan reported confirmed case of 1,511. Hong Kong SAR cases number was 1,037. Macau SAR 45 cases. Taiwan region 429 cases. On April 29th, the imported confirmed cases was the lowest among 35 days. 2/3 of the patients have been discharged out of a hospital. However, in overseas markets, there is an increasing surge of the cases, and also we are trying to stop research within China. For the current domestic cases, 30% are severe cases. We have to give a full play to the role of high-level experts and do our best to rescue those patients. So that's about case information. May 1st holiday is coming. The expert reminds all the people to go nearby scenery resort and try to avoid peak time. Don't go into clouds, and also perform personal hygiene. So in the trip, if you suffer from a fever, fatigue, or dry cough, please go to the nearby hospital as soon as possible. Now, we go to the question and answer part. Now the floor is open. You can ask questions targeting at the experts. Please identify yourself before asking questions. On the right side, the first row, the second reporter. Thank you. I'm from China Daily. We know that on January 24th, Shanghai began to initiate the first level emergency response to the epidemic, and what measures has been adopted by Shanghai after that, and what are the roles played by those measures. Thank you. Now the floor is given to Wu Jinglei. Thank you. Thank you for your question. From Shanghai's experience, early intervention is very important for the prevention and control work. On January 24th, we initiated a first-level response, and our response can be classified into two phases. Early intervention is very important for prevention and control. Before January 24th, we set up organizational structure and set up early warning systems, and also we prepare our staffs for this epidemic, and we send early warning signals to all the hospitals in Shanghai. And in January, we sent out these signals already. And in a timely manner, we organize experts to make a judgment, because this is a unknown respiratory disease. For society with a lot of human transportation, this kind of virus transmission is very important for us. Second, for fever clinic in Shanghai, we began to step up our monitoring over those clinics. We try to monitor their trainage system and monitor their staffing. Across Shanghai, for all fever clinics, we organize training for all the staffs. And in January 17th, we sent out the work plan for rescue of Shanghai to all the hospitals in Shanghai. That's the early work that we have done. We also do some human resources preparation. After January 24th, based on the preparation work, we also step up our efforts in several fronts on early treatment, early diagnosis, and early treatment. And based on the previous preparation, we expand fever clinics and separation treatment method. For each fever clinic, one suspected case will be isolated at once upon identification. So we have requirements on the isolated bed, on the quality and the quantity of isolated beds. The second measure we adopt is treatment first. So once you are under suspicion of this disease, you should carry out active treatment. After we initiated the first-level response for fever clinic, beside the traditional clinic, we add imaging, respiratory, and first aid equipments and staffing for intubation, ventilators. All of these are equipped at the fever clinics so as to prioritize treatment.
Also, through the practice, we've learned that the radiology judgment is very important. So at the outpatient service, the hospitals with certain conditions will be equipped with these CT devices. We have equipped these outpatient services with dozens of devices like this one. I think this is very important for us to increase the emergency responsibility of the outpatient service. After this first level response, we also resort to other experiences. Based on our traditional outpatient service, in 182 communities, we have set up the outlet outpatient services because community is a very important area for us to fight against the COVID virus, and the services are very much required at a community level. We could do something in terms of screening of the patients with fever. So all these measures are conducive for Shanghai to identify these suspected cases and to ensure the timely quarantine and timely curement and treatment. If you look at all the situation and we have done in Shanghai, 280,000 fever patients have been admitted, and 10,000 patients have received treatment. 8 cases imported from abroad at this community level outpatient service. Thank you very much for your question. Next question, please. The third row along the aisle, please. I'm from CCTV. My question is for Mr. Zhang Wenhong. We know that Shanghai is very sufficient in medical materials with a lot of experts. Shanghai has sent out its medical aid teams to Wuhan. We also have your local team in fighting against the local disease. What have you done to coordinate all this medical staff locally? Yes, you are right. We have a lot of comprehensive hospitals, very famous around the world. We have a lot of experts in Shanghai. Following the situation of the epidemic, we have made allocation among these experts. Some went to Wuhan and some stayed at home in Shanghai. Our advantage is that we have a lot of experts, but how to coordinate them so as to ensure cooperation among them, to ensure the efficiency. This is one of the concerns. Traditionally, for those severe cases, they might be admitted in the ICU or in those severe case wards. But in the very beginning, we've noticed this was very specific and very special case. We have to do a lot more so as to ensure satisfactory effect. As a result, we have designated 2 hospitals. One is for adults, one is for children. I was expected to be working with these hospitals every day. We have a special team. Our team members are from the pneumology department, TCM department, ICU department. Our team, expert team, composes of 14 high-level specialists. They stay in these designated hospitals around the clock. We visited all those severe cases. There is another team, apart from the expert team. This team were directly engaged with patients, and they have day-by-day communication with expert team outside the wards. We also have supportive teams, apart from the teams not only for the severe cases. We also have the ECMO team. We also have a CRRT treatment team. We also have the nursing team. When we went to Wuhan, which will be explained later, we also have a team specialized in psychological support. When the first case appeared in Shanghai, I went to the designated hospital, and from day one, our psychological team were located or went to the hospital as well. Well, this is a very important, actually highlights of the composition of the teams. And interdisciplinary cooperation across departments actually is the guarantee for success in fighting against the COVID-19 virus. We are very practical in ensuring the cooperation across the different departments. And these experts and these members have to stay in where they are expected, and they cannot leave until the very end of the virus epidemic. We talk about coordination, and we try every means to avoid fighting against each other or quarrels. And I think the evidence-based methodology is very important. Evidence-based discussion is going on every day among all these experts. Only by this way can we ensure the implementation of our methodology. In the very beginning, all those evidence adopted, including the morbidity, the fatality, among others, have been concluded and summarized, and we put forward the various processes in treating on different stages so as to reduce the morbidity of the severe cases. I think interdisciplinary cooperation will reduce the fatality of severe cases. And evidence-based methodology is also very effective in curbing the further spreading of virus. Another experience which has been talked about across the globe, Shanghai team and teams of other parts of China have some innovative findings. All these innovative findings are culminated with the rest of the world. We are formulating the methodology which we believe is the most effective based on all these practices. A lot of research findings have proved all these are very effective. I think anti-virus methodology is just one of them. We also have some other methodologies incorporated. And methodologies are different in different stages. It is a kind of case-by-case therapy and treatment. 9% of the cases might be the exception, but the case-by-case therapy is the general principle, and this is our innovative therapy or treatment. So from this, you could see, starting from January to February, the perception of dangerous and severe cases reduced to 23%. And in early March, it is only 17%. And later, recently, the proportion of the dangerous and severe cases further decreased. For the time being, the figure is only 3%. All these statistics have shown that China's model of cure and treatment is evidence-based and is innovative and is interdisciplinary cooperation across departments. For the days to come, we know that there will be more cases imported from abroad. We're still facing this challenge. And this experience will be helpful for us to fight against the virus in the days to come. Thank you. Next question, please.
On the left side, the second row journalist. Thank you. I'm from Hong Kong Business Review. COVID-19 is very infectious. Among the confirmed cases, many of them are getting the virus from close contact, and there may be clustered cases. We know that Shanghai is a super large city with regular residents of 24 million and with a large migrant population. Once you identify a suspected case, how can you, for the first time, to stop this transmission at the first possible time period? Thank you for your question. The floor is given to Mr. Guo Xiaodong. Sun Xiaodong. Epidemiology investigation is very important to stop the transmission, and in the prevention of COVID-19, Disease Control Center (CDC) plays an important role in this epidemiology research, and we have four considerations. The first one is that we have to be confident. Confidence is very important. In Shanghai, when we do the epidemiology research, we mobilize two-level CDC in the city, at the city level and the district level. That is the two-level CDC to do the epidemiology research. So we also mobilize the community center to do the epidemiology research. So in total, we have 2,000 people. The core team have 737 people. That is the CDC staff. With this kind of staffing, when we do the epidemiology research, we are very confident. Second, we have to be careful. In the research, we have to trace every contact and go to details. Especially, we have to find out each suspected case, every trace of their life, every contact of their life have to be identified. So this is a great test of our carefulness. Third, we have to be persistent. With one investigation, we cannot find all the contact. Just like the police investigate into a criminal case, we have to be persistent in trying to find the evidence. In Shanghai, there are some cases like this. For example, we have one cluster case, one man, one lady, two cases. The lady was transmitted from this man, but we cannot find out from whom this man got the virus from. So the CDC are very persistent in the tracing process. We investigated about 160 persons. Finally, after 7 days of hard work, we identified that this man have close contact with another confirmed case in swimming pool, and this confirmed case in swimming pool also are related to another clustered cases, and these cluster cases are also related to clustered cases in another province. So it means that we have to be persistent in our research. Next, we have to be caring, patient, and care about the investigated, because the investigated is the patient. He is not our enemy. So we have to provide help to him or her, help him to recall all the related activities. This may help us to control the pandemic, and also this can also show our human care given to the patient by CDC. Thank you. We allow further questions. On the left side, the third row, the third journalist. Thank you, Chair. I'm from Hong Kong Economic Herald. During the pandemic, one photo becomes very popular. A hospital worker, a doctor, accompany a patient to see the sunset. And how about the patient? Can you tell me this story? Now the floor is given to Mr. Chen Erzhen. Thank you for your question. For this popular photographer, there are two characters. One is from Shanghai Hospital, from Zhongshan Hospital, Mr. Liu Kai. Another is a patient in the age of 87. He used to be a violinist. On March 5th, in the afternoon, before sunset, Mr. Liu Kai accompanied this patient to do a chest CT. On the way to the chest CT, they saw the sunset, and so Mr. Liu Kai let the patient to stop for a while to see the sunset. A volunteer from a university take a photo of this scene and put this photo online, arousing a lot of attention. Many media friends are interested in this story. Within this story, we can find out that our doctors show human care towards the patient. On March 11th, Shanghai medical team to Wuhan have completed our task and will withdraw from Wuhan and come back to Shanghai. Mr. Wang, the patient, bring in the violin and play the violin in the hospital ward. The name of the music he plays is Meditation. So he wants to say goodbye to the doctors through such a special song. This story shows the kind of a friendship between the doctor and the patient. It fully shows that Chinese people, in the process of the fight against COVID-19, we work together as the same team, and we try to help each other. This is the most important spirit of this fight. On April 9th, Mr. Wang successfully got discharged from the hospital, and he has finished medical observation and came back to the home already. On that day, he have a video chat with Dr. Liu Kai. Now this patient is very healthy and is very happy. Thank you. We have further questions. On the right side, the fifth row, the first journalist on the aisle. Thank you. I'm from Daily Economic News. We understand during the SARS period, Shanghai, because of good prevention measures, there is no bigger cluster of cases. Well, for COVID prevention, do you learn from SARS prevention? What are the further measures adopted in COVID-19 fight? Now the floor is given to Madam Liu Hui. Thank you. Thank you for your question. For COVID-19 prevention, early prevention and early measures are very important. So such measures are also adopted. For community health center, we promote our health communication because during the SARS period, Shanghai people pay high attention to personal hygiene and pay high attention to air ventilation. So health communication is very important to promote health awareness. So in the past years, we pay high attention to health communication. So that's why during this epidemic, health communication plays an important role. We have different ways of health communication, targeting a wide audience, and we send a letter to all the neighbors about health knowledge and about hospital information at the beginning of this pandemic. And we set up a self-management team within the communities and get the communities get used to this new normal. And we have hospitals, care homes within our community. So we compile different guidance to them. And within our community, there is an industrial zone with centered human beings. So we use WeChat to promote and communicate health information to them. And they can also consult with us on health knowledge on WeChat. We help them to resume their work successfully. During the SARS period, we rely on the community and the street neighborhood to find key suspicious cases, and we have a community service center, CDC, and community volunteers. We have a 4-person team or even larger team to look at the close contact, to verify information, to ensure that the key person will not be neglected. So we have a very safe net against this prevention.
Also, we highlighted the focuses in fight against the SARS. For example, the centralized observation. we have either the at-home quarantine or a centralized quarantine. And targeted people include close contact and also those who returned from abroad. So we have very highlighted focus in our work, starting from SARS outbreak up to now. The community service center as the basic outlet of the overall national network has played a very important role. Our role actually is getting more important. We're engaged further into the fight against the virus. I think the community health center need to be better in management and more effective in fighting against the virus. And this is our mission. Thank you. Next question, please. The first row on the left, please. Thank you. I'm from Oriental TV. Curement and treatment of patients has always been the top priority. Shanghai initiated the centralized admission of the severe patients. And what kind of measures have you done to admit these severe cases, and what kind of measures have you done to treat these severe cases? Mr. Wu, would you please respond to this question? Talking about what we have done, well, actually, for concentration, for centralization, we think are very effective. In the aftermath of SARS outbreak, Shanghai Infectious Disease Hospital was innovated with a very well-established quarantine area. And also, we have the hospital for children established a new building, which also was designated as the area for admitting the coronavirus cases. So these are two the designated areas to admit severe patients in the very beginning. I think the centralized admission of patients in the very beginning can help us to avoid waste and can best utilize the medical materials and experts. We have about 300 negative pressure beds. We also have 200 negative pressure wards and standby beds. So in the very beginning, we had sufficient beds for patients. We also have an area for restoration. Well, this is a kind of standby resource for the emergency response. So we had sufficient beds from the early stage up to now. We have, for the time being, 200 beds that have never been used so far. In terms of the cure and treatment of the patients, we have, as I mentioned before, we have a centralized medical experts. The hospital is specialized in infectious disease treatment. ICU and ECMO are specially required for treating these COVID-19 patients. We have collected and centralized all these devices from different hospitals. We have collected and gathered the specialists from different hospitals into our hospital. Our nursing team is also very effective. Apart from that, in admission of patients, we have not only above-mentioned teams, we also have a TCM team. For each and every ward area, we have a special TCM team. We have a psychological supportive team for each and every ward. And those who need a ventilator, we have the ventilator administrators standby to provide their support. So for these two designated hospitals, the medical resources are sufficient. But of course, the patients are comparatively less compared to those in Wuhan. But we've done a lot in preparation. For example, in case the beds are in shortage, what kind of a hospital that could have the potential of being transformed or innovated. And we've prepared in formulating the response mechanisms to be equipped in other hospitals for pre-screening. So in general, the two designated hospitals are operating quite smoothly. With the gathering of the resources and the centralization of the resources, the result is quite satisfactory, and resources are being very effectively utilized. Thank you. On the right side, the second row, please. The epidemic is getting very severe globally, and there is a higher challenge of cases imported from abroad. And for example, there are 50 cases being imported from abroad on the same airplane. So what kind of measures have you done to respond to these cases imported from abroad? Are there any measures that is unique or innovative? Thank you. Mr. Sun is going to respond to your question. Thank you very much for your question. So, yes, we are facing pressure of curbing the spreading of the virus from the cases imported from abroad. We confirmed once 50 cases one night from one airplane. We've done a lot. As early as March 5th, we went into Pudong Airport. At the peak level, 45 medical workers from our center were dispatched to Pudong and Hongqiao airplanes. What are they doing there? They are collecting health information declared by the travelers from overseas. This will be helpful for investigation of epidemiology. It will also help screen the suspected cases and close contacts. Second, CDC helped the ports and customs to work on the lab examinations, which is also supported by the municipal disease control labs to do, for example, a NAT to make sure the accuracy of lab testing. Number 3 is to investigate over contacts. This actually is based on our experience in fighting against the influenza in 2009. In the later half of January, we set up a team to follow the close contacts. For the airplanes, 160 airplanes or 160 flights, international flights, have been investigated and surveyed, which involved about 6,000 people. Fourthly, we provide consultancy service and do some publicity work. We use 5 languages: Chinese, English, Korean, Japanese, and Italian, to do the publicity and to provide advisory services to the international travelers coming to China. On April 10th, Su-208 from Russia flights, 52 cases were confirmed. Their basic information were collected very accurately by us that night.
Thank you. We allow further questions. On the right side, the 4th row, the journalist on the aisle. Thank you, Mr. Mi. I'm from China Family Daily. After the happening of a pandemic, Mr. Zhang Wenhong becomes a very popular person on the internet, and he has done a lot of communication, and he has a lot of popular sentences said with wide transmission and wide communication. Why you spend so much time on communication? Are you feel pressured on internet because of criticism? Thank you. Thank you for your interest in me. If you are my family member, you will feel worried about me because family daily care about family members. That's why you ask me this question. Many people care about this question also. I'm working at a designated hospital in Shanghai for COVID-19, so my work is very busy every day. In Shanghai, all the doctors, especially myself, and working together with other doctors, we not only involved in treatment, but also are involved in prevention. We are fully aware that if you already got the disease, it's too late. So it's better to prevent the disease from happening. At present, we have a temporary success because of prevention and control. How can we do the prevention? So communication is very important. So scientific knowledge communication is very important. So it means that experts shall communicate with the citizens. However, communication or scientific knowledge communication is a communication process. So we have to tell our basic strategy to the citizens. So at the very beginning of the pandemic, not only myself, but also other experts in basic health, in clinical health, in psychological health are involved in setting up a communication team. At that time, I'm the leader of the medical team. However, not all works are by our team. Actually, this is a human campaign, so the work done by doctors are limited. Whether we can win this war depends on whether we can mobilize all the citizens. Chinese citizens have been mobilized during this fight against COVID-19. At that time, if you stay, I say a sentence, if you stay at home, then you are a warrior. It means that if you can keep social distancing for more than 2 weeks, we can effectively stop the transmission of the virus. Do you think if I say such scientific words, people will understand that? So I will just say, if you stay in the home, then the virus will be suffocated. It means that the transmission chain will be stopped. So for communicating with the citizens, we should communicate with the citizens in a bad way. If you just say you should not go outside of your home, you have to wear your mask. If you do not do this, you will be criticized and will be punished. If you say this, I think people will not listen to you. So in the communication process, we have to communicate this strategy in an effective way. Such kind of scientific knowledge communication means that it's better to tell people how to fishing instead of giving people fishes. So you can post a notice requiring people not to go out for 2 weeks. If you don't tell the reasons, no people will sustain after time goes by. But if I explain the reasons well, in today's Shanghai, in today's China, we can get a big victory because of the citizens' compliance with our advice. So I believe this is a big successful factor of this war against COVID-19. We believe that communication and prevention control are equally important. So we have a WeChat number, and At each time we send out an article through this WeChat number, a lot of people will read this article. The mostly read article is 25 million, so it was reposted on the microblog for 1 billion times. So through such kind of communication, we can get this message reposted by 1 billion. So this is more effective than in preventing the disease. So this is important event or important endeavor that I have done in my life. I also published 2 books together with other medical experts about how to prevent COVID-19. The circulation amount was 1 million, translated into Italian, Persian, French, Japanese, and we don't take in any money. We don't charge royalties. We don't want to make money from such a book. We just want to make the communication. And also, another book is about COVID-19, 2019. So this is the first time we, in Chinese, to use the COVID-19 to name this virus. At present, we believe it is a kind of a pneumonia. In later stage, we found this virus is very sly, and we found many organs will be infected by this disease. So this is the first book about COVID-19. It was also translated into different languages, widely circulated in the world. We don't charge royalties also. We believe that communication of knowledge is for the prevention of disease, not to make money. I'm very happy to get a letter from Ambassador Cui Tiankai, Chinese ambassador to U.S. I'm very happy and very proud of myself for being able to communicate to the public. I do not feel proud of myself for receiving a letter from ambassador. When the ambassador writes a letter to you, it means that he told me my words can calm down the overseas students and enable them to know what to do. So this kind of communication is very important, equally important as seeing patients in the wards. We are continuously communicating with overseas doctors, with domestic teams, communicating with Beijing hospitals team headed by academicians. We communicate with Singapore, Italy, France, U.S., Bangladesh hospital teams. This kind of academic communication can help us to explain in an academic way how China cope with COVID-19. So communication of knowledge is very important. So this communication happens at 2 levels. One is with citizens, one is with hospital doctors. Thank you. I want to thank Dr. Zhang Wenho again for his hard communication work during the COVID-19 pandemic. Now we love the left side, the 4th row, the journalist on the aisle. Thank you, Mr. Mi. I'm from Xinmin Evening Post. My question goes to the medical team to Hubei. For the first batch of medical team to Hubei, what kind of difficulties you are facing, and how do you solve those difficulties? How do you solve the cure rate, and how do you reduce the mortality rate, and how Shanghai help you in this process? Now I'll give the floor to Mr. Chen Zhen. Thank you for your question. I am one of the members of the 3rd medical team to Hubei. I headed a team of 148 hospitals, and we help Wuhan 3rd hospital, 1 ICU, and 1 2 severe case wards. When we were in Wuhan at that time, Wuhan see a lot of surge of cases, and the cases increased exponentially. At that time, Wuhan's health system was on the verge of collapse. Although we have support from different medical teams, there were shortage of staff, shortage of PPE, and also shortage of medical equipment as well. Our medical staff are also a shortage of living materials. At that juncture, we were working together with hospital doctors in Wuhan, and we worked together to overcome many difficulties
to make sure that our work could be implemented smoothly. One of the critical issues is that we've got support from the rest of the country. By saying that, I mean the relevant governmental agencies, the public donators. They have donated various kinds of PPEs, medical devices, and also living materials. For example, the large SOEs, Shanghai branch, including Jinjiang International, Green Group, among others. They've provided sufficient living materials for us. More importantly, we've ensured the transportation from Shanghai to Chongqing. The railway transportation were guaranteed for the transportation of all these logistics and PPEs being transported from Shanghai to Wuhan. In terms of the clinical treatment, the first and foremost, the security issue. We set up an interim, the medical administration and quality control system to ensure security and safety of patients. Second, to ensure the security and safety of medical workers. On the other hand, during clinical treatment, we pay a lot of attention to quality control and procedure standardization. We have a team in place for quality control. We follow closely the treatment procedure issued by the country in line with the real situation of the local cases. As Mr. Zhang mentioned, a Shanghai medical team constantly communicated with our colleagues at home in Shanghai, and we refer those good practices to the frontier in Wuhan and Hubei province to ensure all those severe cases could be provided with treatment plans, case by case, to ensure the cure rate and increase the cure rate in the end. So we've been quite successful in overcoming all these difficulties. Of course, this cannot be done without the support of our local colleagues, as well as support from the rest of the country. Thank you very much. Next question, please. On the left side, the second row. The lady, please. Thank you. I'm from Economy Daily. China is now working on the home-based doctors for different families. What are the challenges to improve this mechanism to make sure that the home-based physicians and doctors could better serve the family and household? Thank you very much for paying attention to these more than 5,000 family doctors in Shanghai. Actually, family doctors have done well in keeping well 3 lines of defense. One is at the community level. The community level outlets have opened its family doctor services to community members. We have provided 50,000 prescriptions to those patients with chronic disease. And for those 16,000 chronic disease patients, we have done the very detailed monitoring of these chronic disease patients and we have regular visits of these chronic disease patients. We also pay a lot of attention to the call contact with the patients. And we answer questions, we provide the advisory services, and also we provide psychological support. About 8,000 patients have received calls from our family doctors. Number 2 is to keep well the gate of a university campus and also different communities. We set up a 4-people team to ensure the safety of a community, and we do the screening in these at the community level. And if we identify some suspected cases, we either ensure the proper home quarantine. We have actually surveyed 1,172 households to make sure that the proper quarantine is conducted. On April 7th, the graduate students in the primary and the middle school students return to campus. So the family doctors need to communicate with schools to observe these students in terms of the personal hygiene and to collect information of all the students at campus. And also the first class for these students is given by family doctors. Next level is to keep well the gate of the city. At different street corner, we try to check and to investigate, and the family doctors are actively involved in the street investigation and screening. Some of the family doctors have been involved in establishment of the centralized quarantine centers or hotels. Some of them have been stayed with this centralized quarantine hotels for over 100 nights. Those quarantined cases included the close contacts and also travelers traveled internationally, among others. They've tried, to very hard to provide and ensure their service so as to keep the gate of the city safe. How to push forward with this family doctor magazine? I think we should do the following. Number 1, to strengthen the communication between the doctor family with the community, with the schools, with relevant organizational agencies, and try to increase the contract signing rate of them to make sure that they could be closely communicated. Secondly, to set up the digital archive and to provide the internet plus diagnosis for different households. In Shanghai, we've already have this digital service provided online, and the family doctors could provide their service through this digital platform. Number 3, during the epidemic outbreak, the community level service centers, altogether 182, have set up their fever clinics. Through these fever clinics, we could timely identify the suspected cases and try to transfer those suspected cases to proper hospitals. So the transfer mechanism could also be improved between the clinic and hospitals. In that way, we can ensure the accuracy of services provided by the family doctors. Thank you very much. Next question. The 5th row on the left, please. Thank you. My question is, ever since the epidemic outbreak, We know that medical workers have done a lot and have faced a lot of pressures, working pressure and psychological pressure. They've been raising with the time. They've been fighting against the virus. And so I'm wondering what are their feelings as medical workers during this epidemic.
Thank you for your question, and thank you for the interest and attention given by people of different part of the society. Thank you for the care you show to us. In the fight against COVID-19, medical staff have do their contribution, as mentioned by Mr. Zhang Wenhong just now. And this is recognized by all. That is, this fight is a fight involve all citizens. Medical staff are only part of the fight against COVID-19. For medical team workers to Wuhan, we are called heroes working in harm's way. But for us, it's just for us to do our daily job in another place. For all citizens in the society, all of them are taking actions to prevent this disease from transmission. You may find out that our policemen, our community workers, our officials at the grassroots level, our volunteers, and also all the journalists seated here are working harder for the prevention of COVID-19. With your committed work, with your passion, all the medical staff are encouraged by your commitment and passion. So all the doctors and the nurses are performing rather good, and they are practicing their commitment to the medical profession, to be loving, to be persistent, and to be devoted. And we also see the emergence of many real heroes, and we will learn from those heroes, enable our nation to be a nation of increased solidarity. Thank you. I know you may have many questions, but due to time constraint, we allow the final 2 questions. On the right side, the 5th row, the 3rd journalist. Thank you. I'm from China Radio Station. On behalf of Central Radio Station journalists, I want to ask a question. May 1st holiday is coming, and for long-term prevention mechanism against COVID-19, what are the experience that Shanghai can share with us? Thank you for your question. Now the floor is given to Mr. Wu Jinglei. For pandemic fight, different cities, in line with their different situation, will come up with their localized strategy. While for Shanghai, for the current practice of Shanghai, we have the feeling that in the following prevention against COVID-19, we should have 2 focus. One is COVID-19 prevention, one is a resumption of work and resumption of the economy. So Mr. Zhang Wenhong have mentioned that the citizens should be motivated to be actively involved in the prevention work in the long run. Director Zhang Wenhong have mentioned he have written a book, and recently we are communicating more knowledge to the Shanghai citizens so as to mobilize the citizens, enable them to wear a mask and have hand hygiene and have air ventilation within the room and avoid crowds as well. So if we look at Shanghai's situation, we believe there are several issues we need to pay attention to. First, Shanghai have to fight against imported cases, so we have to keep our entrance safe. Just now, Mr. Sun Xiaodong have mentioned that prevention against the important cases are very important, and at the same time, we have to resume the economy, resume the work, and also we should start the work from community. Community management role should be promoted. For example, temperature scanning and health code scanning at the community entrance are very important. We are also making use of Shanghai Health Network to mobilize all citizens to do the health monitoring. And also, when we achieve the resumption of work at airports, at railway stations, and at the port, we should strengthen temperature monitoring at the subway station, at the airport, at the school gate. We are promoting automatic temperature scanning without using the temperature gun. And we also set up certain rules to prevent over-concentration of people. And also on April 27th, middle school students of Shanghai return to their classroom. How can we keep the school gate safe is very important for long-term management. After April 27th, when the resumption of schooling is achieved, we pay close visit to schools, and within the day, the temperature will be taken for 2 times. And once we identify any suspected cases, they will be sent to nearby hospitals. And also, for resumption of work, we should try to ensure resumption of work. We have 24 million residents and a large number of migrant workers in Shanghai. So we have to promote resumption of work. For health workers, we will take active measures to help those companies to resume their work. So in Shanghai, in RNA testing, we encourage the companies, the PSUs, the schools to go back to work. And for individuals, we expand RNA testing as well. In this way, we can enable the work to be carried out in an orderly manner, as mentioned by my colleagues just now. In this whole process, we should pay special attention to people working at key posts or special posts. For example, for care workers at elderly care homes, we should focus on their health as well. And also, community workers should be prioritized as well. On the sixth aspect, monitoring posts should be strengthened. Monitoring posts have a close relationship with the health officials. If a patient have some symptoms, they have to go to hospitals. And the monitoring post will help us to identify those patients. So in Shanghai, we strengthen our fever clinics, as mentioned by Mr. Liu just now. We set up 182 monitoring posts. For fever clinics, their services can be extended to communities through this 182 monitoring posts. For early identification, early isolation, early transportation to centralized hospitals. In Shanghai, in the establishment of fever clinics, we believe that tiered system is very necessary, and we have to enable the hospitals at different levels to enhance their capacity to enable faster diagnosis. Just now, I have mentioned that for a Russian flight to Shanghai, within a night, we identify about 50 cases. So if the fever clinics is not capable, it's difficult to identify those cases. So in the airport clinics, we even equip that clinic with CT to achieve early identification. So based on Shanghai's experience, that's the normal measures we will be taking in the long run. These measures are rather effective and prove to be effective and help with the resumption of work in Shanghai in an orderly manner. Now the last question on the right side, the third row, the third journalist. Thank you, Chair. Wenhui Delay. In this month, Shanghai mentioned to establish a globalized health city in the world. So what is the gap between Shanghai's current status and your goal?
Mr. Wu is going to respond to the question. Thank you for your attention to the public health undertakings and our goal set for Shanghai. Shanghai as the metropolis has its own uniqueness. Population density is huge, but the space is very small comparatively, given its huge population. So public health security is an important part of the security of the whole city. I think this is indispensable to have a good public health safety in place. Second, we have learned a lot from our fight against SARS and apply them to the fight against COVID-19. But during the whole process, as we always say, that we are working by learning. We've discovered something that we are not that sufficient. For example, pre-warning system. For Shanghai, we are very sensitive in collecting and capturing those sensitive information, but those reporting system for the infectious disease is not sufficient and effective enough. We need to have a better, improved pre-warning system in place. Second, our commanding system. We have a commanding system for the time being, but the social resources mobilized by this system has been further increased compared to that during the SARS outbreak. Number 3, you may have noticed we have 3-level diagnosis and treatment levels. We also have the 3-level CDC, Disease Control Center. But we need to do more in the prevention and control and how to communicate prevention with the cure and treatment. We've also noticed that comprehensive guarantees capability is not sufficient. Although we have the storage of masks and other devices, but for the fast spreading virus like COVID-19, this comprehensive guarantee system need to be further improved. Next one is the modernization of the disease control system. We are still lagging behind compared to those in other countries. Talking about the special team building, we need to develop more human resources specializing in the public health security. We've now formulated some suggestions, opinions in improving our public health security and system. By doing that, we have put forward our goals that need to be quick in response and highly effective, coordinative, and joint, protection and control in its practice. Furthermore, based on this system, which need to be professional and accurate, quick and accurate response in terms of the medical experts and medical resources. We need to improve ourselves further. We hope that we want to make our city a better and safer place and a more livable place to live in. We need to improve our system for public health, the monitoring and pre-warning for public health, not only the epidemiology, but also the biological, among others. All the systems need to be in place. And the disease control system needs to be further modernized. The community level CDC system will have different layers, but the coordination across levels, their standards need to be coordinated, communicated, and experts and the materials needed need to be coordinated among them. Next one, the treatment and cure system should be brought into full play. As one of the media friends mentioned, apart from the designated hospitals, what about other hospitals? If a bigger and more complicated virus took place, how could we organize all those hospitals? How could we organize our team? The team need to be modularized, need to be professional, and need to be quick in response to any emergencies. We had dispatched our medical team to Wuhan because we've done a lot of preparation already, and more importantly, the social governance system for public health is different from the past and is improving. Another thing, that is the rule of law or guarantee by law. The People's Congress of Shanghai Municipality put forward a provision which is related to rule of law to ensure the public health security. Another point is organizational guarantee and input guarantee. We're going to be more specific there. For the physical input, there is some lines or inscriptions about how to ensure the input from the government. We also have detailed provisions about modernization of the CDC disease control system. With further efforts during the 15th five-year plan, we hope that the public health could be in place, in line, and compatible with the social and economic development of Shanghai to ensure the health and safety of Shanghai people. Thank you. Our experts have introduced to us the basic situation of Shanghai in its fight against the COVID-19 virus. Tomorrow, we're going to invite the medical workers from Beijing University Hospital who have been assisted Wuhan and Hubei province. They're going to share with their experience. Thank you. With that, we conclude today's press conference.